Hello, I'm Dr. Jeff Smith, author of the book Living Pain-Free, It's Your Choice. I'm a board-certified doctor. We practice neurological and metabolic treatments in our office, and it's all explained in this book. I literally wrote the book on living pain-free. I consulted over 18,000 patients last year in this office. I wrote the book on this subject. We're here to discuss migraines and headaches today. Now, many of you have had migraines and headaches, and if you're watching this video right now, or perhaps watching it for a family member or a friend or somebody like that, you're going to learn quite a bit about why medicine just doesn't cut it, why physical medicine just doesn't get it done, and why the migraines and the headaches still stick around, why they become chronic. You ever wonder why those things never go away? I did. I had them before. I understand it. I've experienced it. I've been there. We have a website dedicated to this information. It's called www.thechronicpainclinic.com. Thechronicpainclinic.com. Go to that website. Read our testimonies for patients. We actually have in our office a book that we kept. This book is called Clinic Success Stories. Our patients write their successes in this book, and they also post it on our website. You can read about all the wonderful things we've done and how we get it done, accomplish it, and how we change people's lives every single day. We're here to help. Let's talk a little bit about migraines and why they occur. A lot of times when you get a headache or a migraine, what does your doctor do? He gives you some medication, gives you pills, migraine comes back, headaches come back. Now if you've ever had a migraine, you understand completely. It's kind of like wanting to pull the wool over your head and just calling it a day. The light hurts, sounds hurt, you're sick to your stomach, it's just no fun. You ever wonder why it comes back, why you don't get rid of it? We're here to answer those questions today. These panels are going to discuss a little bit about what we do. How do you finally end your chronic health care condition? What makes us so different? Well, number one, we treat our patients metabolically and neurologically. Neurologically, that means we treat the brain, the spinal cord, the nerve endings, and the tissues. Metabolically means we treat the blood. Blood nutrition, chemistries, calciums, mean corpuscular volumes, things like that. We analyze that information and put it together with a neurological treatment that actually could rid these patients of these problems. So how do you end your chronic condition? Well, we're here to tell you we're going to leave no stone unturned. When we evaluate our patients, we do 4 basic screening tests: neurological tests, blood analysis, physical exam, oral exams, those types of things. Metabolically, let's talk about that. Why is it metabolically so important? Well, for one, we're going to do a thyroid panel. We're going to do a complete blood panel. Okay? We're going to do a lipid panel. Okay? We're also going to do a CBC with autodifferential. Now, I know I've heard it before. Patients come in and say, well, doctor, I've had all these tests. I understand that. Well, did you know this? Thyroid, for instance. When you have a thyroid test, the laboratory lists a range between 0.5 and 5 as being normal, right? So your doctor gets that sheet of paper and says, well, the lab says you're at 3.4. You're within that range. You must be normal. Well, doctor, why am I still sick? Well, there's a difference. When you look at that sheet of paper from the lab, it says 0.5 to 5 is normal. That's the laboratory range, okay? What's the functional range? What's the optimal range? It is 1.8 to 3.0. If you measure 3.4 like we discussed, you're not within the normal range. That's why you're still sick. So we have to look at these chemistries in terms of what is functionally or optimally correct for the patient, for each and every patient, because no patient's the same. All right? So we can assess these things in terms of how they affect your health condition chronically. We do something called sensitivity testing. Now, I doubt very seriously your doctor's ever ordered that for you. If you're allergic to soy, wheat, gluten, sugar, dairy, milk, those types of things, that makes your body sensitive to those things. There's a test for that. The only way to know if you're allergic to those things or have any sensitivity to those things is to have a test. Because if you are sensitive to those things, it can make you very sick. In fact, these are some of the symptoms associated with being sensitive to those items. Okay? Chronic pain or fatigue. Well, if you have chronic pain, you have migraines. Okay? We know that already. Frequent indigestion. Okay? Heartburn. Being bloated after you eat. You ever wonder why that is? Well, constipation, loose bowel movements, ulcers in your mouth. I actually have a patient that has sores in her mouth, ulcers in her mouth, okay? Because she was sensitive to soy and gluten and didn't know it. Her doctors never told her. And she had migraines since she was 5 years old, okay? You can even vomit often, all right? These types of things have to be tested. It is the only way you're going to find out why you're having migraines, why you continue to have migraines, why the medicine doesn't work, okay? Adrenal stress index, that's a test we use to test the adrenal glands. The adrenal glands have two primary functions. Number one, they deal with your body's stress. Now we all have stress, okay? We all, if you have a job, if you have kids, you have stress. That's not going to change. What needs to change though is how your body deals with that stress. And your adrenal glands are the organs that sit above your kidneys. They're the only organs in your body that can deal with that, okay? They're your stress organs. And if they're not functioning, an adrenal stress index test will show that, okay? If they're not functioning, you may suffer from insomnia, okay? Because the adrenal glands allow cortisol levels to be proper in the brain up here. And if they're not proper, you're going to be wide awake at 3 o'clock in the morning and dead tired at 3 p.m. in the afternoon. The other function of adrenal glands, and a lot of people don't know this, is it controls blood pressure. It releases a hormone called angiotensinogen. If that hormone isn't present, your blood pressure is going to go up and down. Okay? You have to run the test. Autoimmune disorders. What is an autoimmune disorder? Well, if you have chronic migraines or if you have any chronic headaches or any kind of chronic condition whatsoever, you could be autoimmune. What that means is your body is literally attacking itself. There are areas in the nervous system, joints, and tissue, and thyroid and connective tissue areas that can be self-attacking. If your body's attacking itself and you don't correct those mechanisms, it doesn't matter how many pills you take. You're never, ever, ever going to get over those migraines. So we need to know, and the only way to know if you're suffering from an autoimmune condition is to take the tests, run the tests by a doctor that understands how to read them. For example, many patients that have chronic migraines that we've treated have tested positive for thyroid. Okay? They have thyroid antibodies called TPO and TPG. If they're too high, you're suffering from what's called Hashimoto's disease. Hashimoto's disease is when your thyroid gland is literally being attacked and can't work properly. What does that mean? Your hormones are going to be out of balance, and you're going to gain weight, and your migraines are going to be 10 times worse. Without that test, we have no way of knowing if you're suffering from that condition. And if we do know that, then we can certainly do something about it. There are certain panels that have to be run, immune panels. Okay? These are blood tests. Lymphocyte subpopulations, Th1, Th2 cytokine panels, natural killer cell activity. We need to know, is your body trying to eat itself alive inside you, on the inside, so we can fix that mechanism. Okay? The immune panels give us an in-depth picture to know exactly what's happening in your immune system. And without that information, you may have a chronic condition your entire life. Okay? H. pylori, that's the gut bacteria. All right? We're all supposed to have a certain amount of that in our stomachs, but when it gets out of balance, it causes problems in the digestive tract. Now, how would that affect migraines? Well, it's pretty simple. It can cause problems with intestinal permeability. Intestinal permeability means that your gut leaks. It's called leaky gut syndrome. Now, what does that mean? Well, I'm sure you've heard stories of people having surgery in their abdomen. And when the intestines get accidentally cut or perforated, or for instance, let's say your appendix bursts. Well, if that bursts inside your gut and leaks that stuff everywhere around, what's going to happen? Well, you're going to be septic. You're going to get sick and potentially die from it. Okay?